Hi there, Dr. Weber. Would you like to introduce yourself to the CMHC audience?
Of course, yes. First, I'd like to thank you for the opportunity to be here. I'm Brittany Weber. I am currently an instructor of medicine at Harvard Medical School, and I'm also associate physician in cardiovascular imaging and prevention cardiology, and I direct the Cardio-Rheumatology clinic at the Brigham, and currently live in Boston, Massachusetts.
Nice. And this is your first CMHC Spring. We're happy to have you here. Have you had a chance to network with attendees?
Yes, I have. And I'm expecting more tomorrow, but this morning I have been walking around, introducing myself to people and finding great network connections, especially in the last connection. Also learning a lot just walking around, listening to the different talks.
Amazing. And do you foresee a utility for clinicians that treat patients with systemic inflammatory conditions, such as dermatologists, to attend events such as this or participate in any other educational activities to learn more about management cardiovascular?
The answer is yes to both. And this is where I think my big passion is actually increasing education and awareness, both at the patient level but also at the provider level. I actually go to the big rheumatology conferences. I was just at a small rheumatology conference in Dallas, where I was also working with a small society meeting in rheumatology, similar to like the CMHC, where I was a cardiologist there talking about this, and it was a room full of rheumatologists. But I think equally important is getting rheumatologists into sessions like this, so they can also learn about the crosstalks and the links between inflammation and cardiovascular disease.
Do you have anything that you would like to add for CMHC attendees in the future?
That this is a wonderful event. It's my first time, but I foresee this is one that I'll be coming to much more in the future, and that it really is an exciting time for a lot of different specialties to come together to all talk about common themes that we all care about. So thank you for the opportunity.
Thank you, Dr. Weber. Perfect.
And 3, 2, 1, go ahead.
We would like to welcome Dr. Jennifer Green. Dr. Green is a professor of medicine in the division of, let me do that again.
Sure.
We would like to welcome Dr. Jennifer Green. Dr. Green is a professor of medicine in the division of endocrinology.
You did it
What
right
is
the
wrong
first
with
time.
me? I just did it perfectly the first time.
You got it. Yeah, good to go.
We would like to welcome Dr. Jennifer Green. Dr. Green is a professor of medicine in the division of endocrinology.
Sorry. Back to the top.
I was confident about that one too. We would like to welcome Dr. Jennifer Green. Dr. Green is a professor of medicine in the division of endocrinology, metabolism, and nutrition at Duke University and a faculty member of the Duke Clinical Research Institute. Thank you for joining us, Dr. Green.
Thank you so much for having me.
And first question we have is, how has our understanding of multimorbidity in patients with and without type 2 diabetes evolved in recent years? And you don't have to answer that.
And then let's just do the close. Thank you for joining.
Thank you so much for joining us, Dr. Green.
3, 2, 1.
Yep. Thank you so much for joining us, Dr. Green.
It's been my pleasure.
That's it.